Hello, everyone, and welcome to your plan year 2020-2021 open enrollment presentation. As she said, my name is Janelle Rivera, and I'm here with Rachel, and we'll be presenting your benefit options for the upcoming plan year. Your open enrollment period will be from February 10th to February 21st, so we do encourage you to go out there and take a look at your options and make your elections.
So this is our 18th annual open enrollment. So you've seen this slide before. You are joining in this open enrollment period with our 27 other member institutions. So I just thank you for being a part of ICUBA, and I hope you enjoy our benefit.
We wanted to first give you a sneak peek of our review today. On the left, what's new for April 2020. We have as Paul said, the new group AFLAC benefits available to you for the critical illness, hospital indemnity, and the accident plan. We have some Rally program enhancements with the introduction of the physician results form. We'll talk about the increase on your flexible spending limit for this year. We'll review dependent verification, and we'll also go over how you can provide or confirm your phone number and email to be entered into a drawing for a prize. And then last but certainly not least, we are pleased to bring you a low increase on your medical premiums this year. And then on the right side, we will be reviewing all of these same great benefits that you have now. So we hope you enjoy.
So first up, you guys saw this slide last year. We explained that ICUBA was a self-funded medical plan, and what that means is that we pay all of the claims that are processed by the medical, pharmacy, and behavioral health benefit managers. Using your premium dollars, we pay exclusively for your benefits or the visits that you receive at the doctor's office through Blue Cross, Optum, and Aetna. Our plans are designed by educators for educators, so we meet monthly in Orlando with all of our member institutions, and we really vet out what works on the plans and what doesn't, and how can we improve. Some of the improvements you'll see this year really are focused and geared towards the Rally program and a few of the other enhancements that we've made. But what ICUBA does is we invest in a long-term culture of well-being so you can be the best version of yourself. And thanks to you as our members and our consumers, you've been great consumers and users of the plan this year. And with that, we're able to bring you a low increase for the 2020-2021 plan year.
Next, we'll talk about the new ICUBA Group AFLAC benefits. So we're pleased to add AFLAC as our newest brand partner. We're bringing to you critical illness, a hospital indemnity plan that has both a low and high option, as well as an accident plan. These new group plans will provide better benefits at a lower cost in most cases. There is also guaranteed issue being offered during this open enrollment, so that means no medical questions will be asked.
Unity School will retain the prior short-term disability offering with the individual rep that you have currently, but just to note, all of the other prior coverages will be offered portability. So if you currently have other coverages that are similar to the plans that ICUBA will be offering, those will be discontinued at the end of March, and you'll be receiving a portability notice on those. You can continue those other policies through direct bill with your individual AFLAC rep. But I just want to set the stage a little bit for you when we review the prior individual plans versus the group plans, because while they do seem like the same company, they're both AFLAC, these two companies are very different. Really the only thing that they share is their logo. So any questions that you might have, if you do continue your short-term disability, the short-term disability will be continued through the individual representative. However, the representative that you know that comes to campus there will not be able to answer any questions as it relates to the new ICUBA offering. You will have a new contact and a new phone number that you will contact related to the new offerings, the critical illness, the hospital indemnity, and the accident. If you do file a short-term disability claim, those claims will be filed with your prior individual rep, and then all ICUBA group policies, all claims for those will need to be filed through the new process and a new customer service number.
And then of the new plans, we'll go over the critical illness first. Coverages are listed here on the left side of the screen. The plan pays a lump sum cash benefit to you. It pays in addition to your other insurance coverage. As we mentioned previously, there is guaranteed issue up to $30,000 in coverage for the employee and up to $15,000 coverage for the spouse. The spouse cannot exceed 50% of that employee election. Just a reminder that children are automatically covered under the employee, so you do not need to make a separate election for your children. This plan is portable, so you may take it with you if you change jobs or retire. And then we just wanted to tell you about one additional benefit. While these critical illnesses are listed here, we hope that you do not have one or you are not diagnosed with one. In that event, you do still have an extra benefit of that $50,000 annual, $50 annual health screening benefit that still applies. So if you do not need that benefit, you can still file for that $50 health annual screening.
Moving on, next up is hospital indemnity through the group AFLAC plans at ICUBA. This coverage includes hospital admission or confinement due to an accident or illness. This plan will pay a lump sum cash benefit to you if you are admitted to the hospital or confined. It pays in addition to other insurance coverage. You can also take this with you if you change jobs or retire. It will be payroll deducted, and with this plan, there are no medical questions asked. So ICUBA will be offering two levels of the hospital indemnity plan, a high plan and the low plan. Both pay the same confinement and intensive care benefit per day, but the admission is where the difference comes in. So if you elect the high plan, an admission will pay $1,000, and if you elect the low plan, the admission on that one is $500. So we've included one of the more popular reasons why people would elect a hospital indemnity plan here for you, the example for pregnancy or delivery. So when you obviously have a baby, you are admitted to the hospital. The admission under the high plan would be $1,000. If you are confined to the hospital for 3 days for that delivery, under the high plan, you would receive an additional $300. So the total payment for you would be $1,300 on the high plan. And on the flip side, the admission under the low plan would be $500, still $300 for the confinement, and then a total of $800 under the low plan.
Next is the group accident plan. After an accident, you may have expenses that you never thought about, and can you handle that? So this plan kind of gives you some reassurance. It'll be there for you in your time of need. It covers expenses such as your ambulance rides, emergency room visits, fractures. If you have a concussion, any lacerations, second and third degree burns, then this is a plan you may want to consider. Again, if you do not need the benefit, there is still that $50 annual health screening benefit that applies.
Moving into the enhancements this year to the Rally program, we're really excited to bring these enhancements to you. Rally will still have the survey as the gatekeeper. So step one after the new plan year, we really hope you get in there and answer the Rally survey questions just to unlock the key to all the gift cards that you could potentially earn throughout the year. The wellness exam increased this year from $25 to $60 beginning on April 1st. The biometric screenings also increased to a total of $40. And then we've increased the number of on-site campus events from 5 to 7. So this coming plan year, you'll have the ability to earn up to $70 with those on-site events. Preventive exams have been grouped together, and you will be rewarded for the very first claim that's processed. So a PSA, a colonoscopy, or a mammogram, the very first claim will give you an additional $50. And then if you are a candidate for a qualified medication change through ICUBA Cares, that is also $50. We also have several coin opportunities for you through missions, city challenges, teledoc registration, tobacco attestation, and clinical rewards. And we know we've heard you. We understand that the coins aren't super helpful in many cases, but we just want to remind you of to keep your eye out for those flash sales, because while you might not think that coins are worth something, if you log in on a day where one of those flash sales is going on, you can use your coins to redeem some pretty deep discounts as far as, you know, health and wellness items are concerned, or even admission to, you know, some really popular theme parks. One other really cool thing that we're excited about, and we've included here, this fun feel-good fact, is Rally opens up charities each quarter, and they rotate their charities each quarter. And last year, iCuba members donated 4 million coins to those various charities, which we're really excited and proud of our members for.
Next, we want to introduce the physician results form. So there's no more fingerprints or additional blood draws for this. Starting April, you can get credit for a biometric screening just by visiting your own physician. We have some pictures of the website and the form here for you to follow along. So the first step in this process is you log into the Quest portal. It's the same site that you would have used if you scheduled an on-site patient service center appointment. After you log in, you can download that form. It contains valid date ranges and unique information about you and or your spouse. So we do want to let you know, don't share this form with any of your coworkers. There's a barcode on it, and all of that information is specific and tied back directly to you. From there, you'll go to your doctor's office, complete your annual wellness exam. The doctor can do a blood draw directly in his office, so you don't have to leave there and go to Quest at a later date. Step 4 is that your physician takes that form and faxes it to Quest Diagnostics. We do encourage you to also get a copy of that form and make sure it's signed, so that if something happens, we know the doctor's offices can get really busy sometimes. So just take it upon your own self to make sure you get that information. And if it's taking a while or you still need to send it, you'll have a copy so that you can fax or upload that form directly to your portal.
And if your doctor does not perform blood work in his office, I know it's hit or miss if your doctor will draw blood work in their own office, you would still just visit a Quest for your blood work, and then you would just need the doctor to sign off on those biometric results after the blood work is completed. Just some Rally reminders for you. The clinical rewards for chronic conditions is still available within the Rally site. So if you receive some educational materials based on one of these conditions, it's just providing some reading material or trying to connect you with a health coach for an opportunity to earn some additional coins. On the opposite side of the screen, we are highlighting city challenges and private sweepstakes. Just a reminder that the private sweepstakes, or the city challenges rather, are still available. iCuba does award a $50 Amazon gift card to a winner every 14 days. You just need to remember to enter the city challenges, sync your device, and then every time a milestone is reached, you're entered to win. We also have private sweepstakes attached internally in our office to this Rally survey, as well as the missions and the other challenges that are available.
Next, we just wanted to kind of show you the value of these improvements that we're making to the Rally program. Most of you who have been to the iCuba portal or through an enrollment are familiar with Emma, so we're going to use Emma in an example here today. So meet Emma. By the next open enrollment, we anticipate this will be her story. So Emma has downloaded that Blue Cross and Blue Shield mobile app we talked about. She was able to locate a Blue Distinct Total Care provider. From there, she got an annual physical with that BDTC provider for free, and because of that, she's already earned $60. Her primary care physician submitted that Quest physician results form that earned her additional $40 for the biometrics. So already, just by going for her annual physical, Emma has already earned $100. At work, Emma participated in 5 on-site events totaling $50. And she's hoping to do 2 more before the end of the plan year. During a recent doctor's appointment, Emma was diagnosed as a diabetic. So because of that, she's connected with a Blue Cross and Blue Shield health coach through the Rally Clinical Rewards Program to try to help her manage and control that condition. So to date, she's earned 150 Rally dollars, and she's donated 8,000 coins to various Rally charities by this time next year. So we just wanted to give you an example of really Emma's not done much, and she's earned $150. So it's really easy if you're engaged to get those dollars and cash them in for those electronic gift cards.
Moving on to flexible spending. The flexible spending accounts do require an active election each year. The healthcare flexible spending we'll review first. Both plans are actually funded by you as the employee with pre-tax dollars throughout the year. The healthcare flexible spending is available for immediate use, your full amount elected, and can be used for eligible healthcare expenses for you and any eligible taxable dependents. The new IRS limit for the healthcare flexible spending is $2,750, so it did go up by $50 this year. On the right-hand side, we'll review the dependent care flexible spending account, also deducted with pre-tax dollars. These funds are, however, deposited as they're taken from your paycheck. They're deposited into your dependent care flexible spending account. These funds can be used for daycare services, aftercare, gap camps, summer camps, really any type of daycare service for a dependent under the age of 13. So just as a reminder, if you have a child that's turning 13 in the middle of the year, just be mindful when you're budgeting for that. On the IRS calendar, your household limit is up to $5,000. So both of these accounts are subject to the use it or lose it rule, and there is no annual carryover. So when you are putting aside money for a healthcare flexible spending or a dependent care flexible spending, please plan wisely.
Next, we wanted to review dependent verification with you. Dependents that are not eligible to be on the IQVIA plan should be removed during open enrollment. If an ineligible dependent is removed, the coverage will terminate March 31st, 2020. And we just wanted to include some language here that you will see on your enrollment screen. You're certifying when you complete your enrollment that all dependents that you elected coverage for are eligible to be covered under the IQVIA plan.
Just as a reminder, who's an eligible dependent at Unity School: your legally recognized spouse, a natural child, a legally adopted child, stepchild, a child required to be covered by a qualified medical child support order, a child with proof of legal guardianship who resides with you, or a foster child. As just to pinpoint, a child is a dependent until the end of the calendar year in which they turn 26. And if you do have a disabled dependent, they can remain on the coverage beyond age 26 as long as appropriate documentation of their disability is submitted.
Next, we'll go over how you can enroll in your benefits. You start by going to IQVIAbenefits.org. We know during this open enrollment period, this is your chance to make updates as you choose. Your open enrollment elections will remain in effect until next plan year, until this plan year ends, which is March 31st, 2021. And this is stipulated by the IRS's Section 125 rule. You may change your elections during the plan year only if you experience a qualified life event and only if you complete that event within 30 days. So how do you get started? Of course, you go to IQVIA's website. There'll be a little button that says Start Your Enrollment located at the top of your homepage. You'll click Continue to update your personal information, your family information, your benefits. There's a little box on the screen here as you're going through your enrollment. That will serve as a guide to show you how far you are along in that enrollment. And then once you've finished and you've confirmed all of your benefits, you'll have the option to view, email, or print a copy of that confirmation. If you do need Emma, you can turn her off, but if you need her to help you choose a medical plan or when planning for the FSA, she always is available. You just have to ask her for help.
So just as a reminder, we are doing our infamous open enrollment sweepstakes again this year. So you just have to log on at IQVIAbenefits.org, make sure that your personal phone number and personal email address are correct, step through the enrollment process confirming your benefits, and once you finalize the process, you'll be automatically entered to win.
Next, we want to get into how we strive to improve your access to care by eliminating those barriers. We feel that it's important for you to be an educated healthcare consumer and to understand how your plan works, how it pays for your covered services before you actually get to your doctor's office. So our medical, prescription, drug, and behavioral health plans are specifically designed to try to remove those barriers for you. And so one of the ways we do that is by offering that plan where the deductible only applies to major services, among other things, and we'll review those now.
One of the first ways that we break down those barriers to care is with our special single sign-on section on our homepage. So underneath the rotating banner at icubabenefits.org, you'll see a section that's called My Carrier Accounts. From here, you can get to all of our brand partners. If you've never logged in before, you will have to set up a username and password under your very first time visiting the site. However, when you come back and visit at a later date, you will be able to single sign on and directly connect.
Next, we just wanted to review some of the plan benefits so you can be an informed consumer. On the right hand, we've listed all of these benefits that are at no cost to you. So we just want you to have an idea of some of the things: Blue Distinct total care visits, EAP services, your immunizations, your mammograms, medically necessary labs through Quest, among everything else listed there in that first column. All of those are at no cost to you. That second column, these things do not apply to the deductible. So you may still have a co-insurance or a co-pay, but the deductible does not apply to like advanced imaging, chiropractor services, emergency room, urgent care, among other things. And then that very last column on your right, these are things that the deductible does apply to, and these are all considered major services: private nursing, durable medical equipment, inpatient mental health, substance abuse. All these things listed here, these are subject to the deductible.
So just as a reminder, Surgery Plus is a benefit that we rolled out last year. This is paired with the medical plan, so this benefit brings to you free surgical procedures, anything that's non-emergent but medically necessary. They have a very rigorous process for screening their surgeons, so if you are in the market for a medically necessary but non-emergent surgery, we do encourage you to reach out to Surgery Plus. Teladoc is also available, just a $5 copay. So this is a telemedicine or video consultation. You can just connect with a doctor easily on the go for the more mild conditions that are listed here on the screen. So if it's just a great alternative to actually visiting a physician in person. The Pharmacist Advocate program is also available. So if you have side effects from a new medication, or you're struggling with a prior authorization or a step therapy, or you just want to learn how you can save money by switching to a generic, these are all great reasons why you should call iCuba Cares. They are available Monday through Friday from 9 to 5. Condition management with Aetna's Able To program is also still available. This helps you manage the health or life conditions as shown on the screen here. You'll meet once a week with a therapist and once a week with a behavioral coach to help you tackle the emotional challenges, identify goals, and develop an action plan to help you coordinate your life with these health and life situations. The program does last over a course of an 8-week period, but the results from this program can last you a lifetime. We have many health management and care consultants available. You may receive a call from somebody at Blue Cross, Blue Shield, Optum, iCuba Cares, or Aetna. They are calling because they care, and these are trained health advisors and registered nurses. They're just calling to help you provide tools and education, maybe help you with goal setting, or help you better understand your doctor's treatment plan. So we're just asking you to take a few minutes if you get a number that you don't know calling you and asking you personal information, and it is one of our brand partners, just extend them a few minutes of your time. As a reminder, all visits to a Blue Distinction Total Care primary care physician in a family practice, internal medicine, or pediatric office are always free, so $0 at any of these facilities as a primary care physician. Care Connected is also available to help you with any claims questions or billing assistance, and they can even help you find one of those fancy Blue Distinction Total Care providers. This number is available on the back of your ID card, on the Blue Cross card next to Blue Cross Blue Shield customer service. We rolled out the My Health Toolkit Blue Cross Blue Shield mobile app last year, so if you've not had the chance to download it, we really encourage you to do that. There is some security features built in, Touch ID and facial recognition, but there is real-time data included with the app. You can easily pull up your ID card or reference recent explanation of benefits directly from your mobile phone. The Employee Assistance Program is still available. You do not need to be enrolled in an IQVIA medical plan or any of the IQVIA plans to have access to this program. They do help you tackle emotional, life, legal, financial, and a lot more services. These are just a few of the top reasons that people call the EAP. And just as a reminder, with the emotional, you can gain access to up to 6 free sessions per issue per year, and everything is free and confidential. The EAP also went digital last year, so just a reminder, Talkspace is available if you'd like to text a therapist. You just have to call Resources for a Living for authorization. We have a multitude of mobile apps available to help you break down barriers of care. So I personally have an IQVIA folder on my phone with all of these mobile apps so I can have them available at my fingertips whenever I should need them. We have some great news. The benefits that are provided by the brand partners on the screen are not changing for the coming plan year, so we will get through these pretty quickly. The Blue Cross Blue Shield will still offer the preferred PPO and the $4,000, $8,000 deductible plan. Again, these plans are not changing for the current plan year, so I'm pretty sure you guys are familiar with these and how they work. Just as a reminder, the $4,000, $8,000 deductible PPO plan was made and designed for children for families with healthy children. So this plan gives you the freedom to choose and gives you the benefit of a lower premium cost. This plan also has a 0% increase for children and family tiers of coverage this year. The differences that we want you to be aware of is the deductible and out-of-pocket maximum are significantly higher on this plan. Coinsurance and copays are also higher, and while plan premiums are less, a catastrophic event which requires a hospital stay might end up costing you more. The prescription drug plan is not changing this year. We do have the same tiered approach. Just as a reminder, a 90-day supply will save you money. So if you have a drug that is available at a 90-day supply, we really encourage you to set that up. We do offer some prescription drug freebies that are also available to you as prescribed and listed in the bottom left-hand corner. And we do have that separate out-of-pocket maximum as an extra protection for you. The behavioral health and substance abuse benefits are not changing again this year. The behavioral health benefits are still through Aetna. They provide professional counseling, psychiatric medication evaluations, ABA services for autism, as well as those intensive services. Humana Dental will still have the high option PPO and the DHMO prepaid plan. Just to caution you, the DHMO plan, you must have a pre-assigned dentist in order to seek treatment, and that dentist must be in the state of Florida. So when you're going through the open enrollment process, make sure that you identify a dentist. The base plan is still available for you through IMED, giving you frames every 24 months with a $100 allowance for frames and contacts. Symetra still covers your basic life, basic accidental death and dismemberment, voluntary life, spouse life, and child life. And all of this is available at the site for you to review. If you are subject to an evidence of insurability, you will get a notice within the enrollment process that action is required. What this is letting you know is when you finalize your enrollment process, a secondary portal will pop up from Symetra. It's just asking you a few medical questions. It is kind of a lengthy process to complete that evidence of insurability, but we just want to let you know, do your best, the best you can to answer those questions. This is the only time that you'll have to complete that form. To finally wrap everything up, open enrollment housekeeping, any open enrollment changes made during this open enrollment period will last for the full plan year, April 1st, 2020 through March 31st, 2021. Any changes made outside of the open enrollment period are only permitted within 30 days of a qualified life event. So if you have a baby or you get married this year, those are both considered life events. So if you have questions about that, you can definitely contact ICUBA or your HR department. And then the 1095 tax form is not required again this year, so we're just going to house that safely for you in your employee file. And then all other requirements of healthcare reform are in place, even more generous wellness benefits than are required by law. And now is the time, in addition to double checking your current elections and reviewing your benefits, to also update your beneficiary information. So that is all we have for today. Thank you very much for your attention and sticking with us. I know we went a little bit over time, but we're really excited to bring these new benefits to you this year.